Doctors of Reddit, what is the biggest mistake you've made? Serious. Pathologist here. Biggest mistake I ever made was cutting myself during an autopsy on an HIV patient. Lucky for me, I did not acquire the virus, so everything had a happy ending. For me anyway. That guy was still dead. Edit. Thanks to whoever gave me gold for fucking up at my job. Edit 2. I am going to personally fillet the next person who says relevant username. Doctor here. I don't think you're going to get a lot of responses. The average non-medical person just doesn't understand how certain things happen, and it seems egregious that Dana Carvey had a coronary bypass to the wrong artery even though it's pretty damn hard to find a specific vessel at a specific location on the heart. I'm impressed this isn't a more common situation. Then, after an incident like that, people just think that the doctor. Not me, but my mom. She just retired as an OBGYN, and she told me about a time early on in her career when, while not a real medical mistake, she still almost ruined the operation. She was performing a C-section, I think, and she dropped her scalpel on the floor. Before she could think, she blurted out "oh shit" as a reaction. The mother, thinking something was wrong with the baby, started panicking. It took a team of nurses, the husband, and the mother of the patient to calm her down. Edit. As a very young doctor in training, I misdiagnosed a woman with epilepsy. Some years prior, she had sustained a gunshot wound to the frontal area, damaging the underside of one of her frontal lobes and severing an optic nerve to one of her eyes, as well as some of the muscles that rotated that eyeball. Surgery saved her life, but the frontal lobe was scarred and the eye was blinded, and always pointed down, and at an angle away from her nose. A few years after that, she began having spells of a. I'm a nurse, but I was working in the ER when a guy came in for a scratch on his neck and feeling drowsy. We start the usual workups, and this dude's blood pressure tanked. We scrambled, but he was dead within 10 minutes of walking through the door. Turns out the scratch was an exit wound of a .22 caliber rifle round. The guy didn't even know he'd been shot. When the coroner's report came back, we found that he'd been shot in the leg and the bullet tracked through his torso, shredding ever. Agreed. A surgeon messed up a bit on my sister's knee. Accidentally severed a small nerve and left her with a blind spot in her leg. We could be sued, but we didn't. My sister has always dreamed of being a doctor, as have I, and our family knows how important surgeons are and why they go into the profession. It's really quite easy to say that things should go as planned all the time when it comes to medicine, but the reality is that sometimes mistakes happen, or sometimes they don't, and thing. Can the HIV virus survive very long in a corpse? Farm B here. Couple different quick stories. Heard of a pharmacist who filled a fentanyl patch incorrectly, and the dose was so high that the patient went into severe respiratory depression and died. They're still practicing. Worked with another pharmacist back in the mid-2000s when I was still a tech who filled a script for Prozac solution concentrated. It is 20 mg per ml. Average adult dose is 20 mg. Instead of 1 milliliter once daily, he filled it for 1 teaspoonful 5 milliliters. The child got Serat. My grandmother has had diabetes for about 20 years, and takes a handful of meds to help control it. About 10 years ago, she developed a persistent cough. It wasn't bad, she said. It felt like a constant tickle in the back of her throat. She went to her doctor to find out what was going on, and he ordered a battery of tests concerned that she was developing pneumonia, lung cancer, etc. All the tests came back negative, so he prescribed a cocktail of pills to help combat it. Over the span of 5. Doctor here. I assume we mean medical errors and not general life decisions. No comment on life decisions. For medical error, I will not use a throwaway because I strongly think we should feel free to disclose our mistakes in order to improve quality and learn from each other. My first week of my intern year 1 outside of medical school, when you're on call overnight, and all that, aka season 1 of Scrubs, everyone signs out their team's patients to the doctor on call overnight. I missed a gunshot wound once. A guy was dumped off at the ER covered in blood after a rap concert. We were all focused on a gunshot wound with an arterial bleed that was distracting. The nurse placed a blood pressure cuff over the gunshot wound on the arm. We all missed it because the blood pressure cuff slowed the bleeding. I was doing the secondary assessment when we rolled the patient, and I still missed it. We didn't find it till the chest X-ray. The bullet came of rest in TH. This thread is pretty depressing, so I'll lighten it up a bit. A few months ago, I accidentally ran a creatinine test on a patient when a comp metabolic wasn't ordered. It turns out that the guy was in renal failure, and no one knew. He was about to go in for surgery, I believe it was a bypass, but could be wrong, but I got the results in time to stop them from putting him under. Shit could have been messy. I'm glad I screwed up, and I'm sure he has no idea that he could have died. I have noticed that when I see a new doctor because mine is on vacation, I often get new and important information. When my dad was a resident, he had a guy come in with a GSW to the shoulder. The guy had been caught with another man's wife and had been shot while running away naked. In addition to the shoulder, the patient kept saying he had been shot in the gut. Dad searched all over and couldn't find a wound. But the guy kept complaining about excruciating pain in his lower abdomen. X-ray revealed that, indeed, there was a bullet in the abdomen. Took a while to find, but my dad finally found the entryway. Not a big mistake, but definitely awkward at the time. I was gluing up a lac on a 14-year-old girl's forehead. Anyone who has used Dermabond before knows that stuff can be runny and bonds very quickly. I glued my glove to her face. Her mum was in the room, and I had to turn to her and say, "I'm sorry, I've just glued my glove to her face." In fairness, if she was being treated at the time by an endocrinologist for diabetes mellitus, a hormone deficiency, how on earth did he or she never do a thyroid check until years later? Should lose his license for that. Never mind that the physician may have spent 15 years in extremely rigorous training, went hundreds of thousands into debt, and has committed his life to the profession. No professional should be allowed to do a poor job just because they invested a lot into that profession. That's borderline irrelevant. No engineer says, "Sure, my bridges kill people, but you can't fire me. You don't understand how hard I worked to become an engineer." No, Professor. My C-section was the most traumatic experience of my life, and I have been through a bit, if I may say so myself. Complete accident on your mom's part, but I felt honest panic reading that, thinking of how I would have reacted if it happened during mine. If that is the worst your mom did, though, she was a great OBGYN. Did he take home a brain by mistake? My husband nearly died of a fentanyl overdose after a rookie EMT was allowed to administer it via injection. She gave him 4 times the safe dosage. That's some serious shit. Throwaway, obviously. I'm also going to eliminate pronouns to further de-identify the circumstances. This didn't happen to me, but a doctor I worked with a long time ago. Doctor saw patient regularly for medication management. Patient came back for a follow-up appointment with a very telling side effect from a very low dose of a medication and no improvement in symptoms that the medication was intended to target. Because this particular side effect is relatively mild early on and can also be. I'm a nurse. I've given an anticoagulant blood thinner to the wrong patient. Over the next day his red blood count dropped. He ended up in ICU. My dad was a pathologist as well. It was not uncommon to have specimens in our fridge. Holy shit, how did that guy not know that? Edit. This was not a story of mistake, but it's the most weird story ever. I don't know how I would have reacted if it happened around me. Dentist here. I was performing a simple extraction and preparing for the case when I didn't realize that I had the X-ray flipped the wrong way the whole time. I was viewing the film backwards and pulled out the wrong tooth. When I realized my mistake, I started freaking out, only to find out that by some dumb luck, the tooth I extracted had to go as well. For the record, this happened in dental school, so safe to say it was a learning experience. It was my first and very last time to make th. Fun story. While my wife was having her C-section for our daughter, she overheard one of the nurses say there's only 9, and my wife thought they were talking about my daughter's fingers or toes. So she's freaking out that our daughter is missing a finger or toe, and I keep assuring her that our daughter was perfect, which she was. We found out about 10 minutes later that the nurse was talking about the surgical tools that were supposed to be accounted for, and one of them was missing. So, as an ICU nurse, I've seen the decisions of some doctors result in death. Families oftentimes don't know, but it happens more than you'd think. It usually happens on very sick patients that ultimately would have died within 6 months or so anyway, though. Procedural-wise, I have seen a physician kill a patient by puncturing their heart while placing a pleural chest tube. It was basically a freak thing, as apparently the patient had recently had cardiothoracic surgery, and the heart adhered. ER resident here using a throwaway. I have 2 that I know of tried to protect the kidneys of a gentleman who had to get just a TON of contrast. Ended up giving him too much fluid and pushed him into pulmonary edema. Spent about an hour on BiPAP but did okay after. Did an fast ultrasound on a trauma patient. Thought it was negative, but in retrospect had a small pericardial effusion. He coded about 30 minutes later after said effusion expanded. Had so much head trauma everyone told me he wouldn't. First day of clinical skills, they tell us to replace "oh shit" in our vocabulary with "that's better" or "there we go." So if we drop a scalpel, we say "there we go." Did you have to take an emergency course of antivirals? Once transported a patient for suicidal ideations. Patient had suicidal thoughts and had resumed smoking after a 3-year hiatus shortly after being prescribed Reglan. She repeatedly voiced her opinion to her physician as that she was having side effects, including wanting to kill herself. Her doctor assured her the drug was safe, so safe he had prescribed it for his own mother. After she looked up side effects on the internet, she expressed concern. I once had my deviated septum corrected through surgery and a nose job at the same time. I'm vain, sue me. When they cut up the inside of my nose and cracked all the bones and stuff, they made scabs and blood clots that had to be removed by sticking a thin hose up my nasal cavity that sucked all that crap and gunk away. Well, my doctor was up there and said, that's a big scab, and then sucked it off with the hose. Picture a desk fountain that trickles a steady stream of water. Haha, in nursing school they beat it out of you not to say oops or oh, let alone cursing. They were all it makes the patient nervous, and a nervous patient is a pain in the ass. This is the scariest post I've ever read on Reddit. Here is a good one I didn't cause but saved the day as a resident that was surgically assisting. C-section for failure to progress and ugly-looking fetal strip. All went perfect. Time to take cord blood and I am to fill up the test tube. Surgeon looks at it, and it has one very large chunk of glass broken off of the rim 3 by 4 centimeters. There is an open abdomen in front of us with blood clots everywhere. So as safely as possible we are sticking our hands around to try and find this glass, if it I. My first day as a camp nurse for people with intellectual disabilities, I gave 9 pills to the wrong guest. I didn't know who I was looking for and asked my friend to send out the guest. His hypochondriac roommate walks out, tells me he is the person I'm looking for. I asked my friend for confirmation, who thought the correct person had come to me and confirmed from afar that it was, and I administered the meds. He had a lot of drug allergies. Stomach dropped when the actual person I was looking. To be honest, if a 20-year-old camper had a painful rash that looked red with blisters in one part of the body, 99 times out of 100 it's contact dermatitis, poison ivy oak. Shingles in a young 50, non-immunosuppressed, healthy person is extremely rare. Add to that you're camping in the woods, she made by far the most likely diagnosis. In med school I was following a doc when she did a bedside bone marrow extraction from the sternum. Sternum was ossified, patient was very obese, and by freak accident her pericardium climbed high on the aorta. Combined effect was that the doc drilled deep through the thick tissues, thought she wasn't in the marrow yet because nothing came through, ended up in the aorta evidenced by a sudden high geyser of blood through the needle. Pericardium filled with blood, immediate pericardial tamponade. How does a bullet enter the leg and leave the neck? We teachers are often told that students need to learn by failing. In other words, it's by making a mistake and then correcting it that we learn the most. In medicine, learning by failing can be deadly. But what happened to you has definitely made you a better doctor. And all your present patients are lucky to have you. My brother is a surgeon, and during part of his residency, he had to work in the pediatric unit. He was working with 2 newborns. One was getting much better and fighting for life. He was going to make it just fine. The other baby was hours from death. Was he going to make it? My brother was in charge of informing the families. My brother realized about 15 minutes later that he had mixed up the families. He told the family with the healthy baby that their baby wasn't going to make it, and... Well said. I think you're referring to the end of this episode. Couldn't he find just the clip, but it starts at just before 20 minutes. Oh no! Luckily they teach us pretty specifically about this now. Your grandma was on an AC-angiotensin converting enzyme inhibitor. They are a very common first-line medication for hypertension but have an annoying dry cough side effect for many people. Simply switch the med to another, like an ARB angiotensin receptor blocker, and you often see improvement if the cough is due to the AC. Unfortunately in medicine we often have to rule out other causes, especially in the older adult popu. Won't be the last time you put someone into pool edema. Better than wrecking the kidneys. My problem is half my patients have terrible kidney function and terrible heart failure, so I push them into pool edema, then a little Lasix and nitro patch and morphine and hope the pressure doesn't tank, then a little fluid again as CR slowly climbs, rearranging deck chairs on the Titanic man. In healthcare, we make mistakes. At every level from the top to the bottom, mistakes get made, and you just try to keep them as infrequent and minimal as possible. When I was a student rotating through OBGYN, and I wrote an order for a woman's postpartum continuation of magnesium sulfate, as she was preeclamptic antepartum. I was super careful, because I knew what could happen with magnesium toxicity, and double-checked the order with the resident afterwards. The nurse, instead of hang. Someone else's mistake directly affected me. I was working in Yosemite as a camp counselor, so there was no internet access or anything. I started to get a red rash on my chest, and then on the same place on my back, and it started to expand and crawl up towards my armpit. And it hurt really, really, really bad. As if you had the worst sunburn ever and someone slapped it really hard every time you moved. I went to see the nurse. A new nurse gets cycled in every week, and she looked at it. I saw a patient once years ago for abdominal pain. She had had an IUD placed back in the 70s, a Dalkin shield. Upon follow-up, the GYN couldn't find the string, so he told her she must have passed it. Well, guess what she passed in alright. We found it in the retroperitoneal space near her right kidney 17 years later. She wanted to sue him, but he had retired. Lawyer here. The average non-lawyer doesn't understand how malpractice suits work. Just because a doctor doesn't do the right thing, doesn't make them liable for personal injury. The threshold in the UK is as follows: what would a reasonably competent doctor in that specific field have done in the accused's shoes? In other words, did you meet what was expected of you or not? If you didn't meet what was expected, then man up and take responsibility. It is ridiculous to suggest that just be. Pharmacy student here. Wait, what? Yeah, I didn't do it. I saved the lady. I was on rotations. We had a lady who was taking very high doses of OxyContin, roughly 240 milligrams a day for pain. I don't remember what it was related to. She had a laundry list for her PMH. Let us go with cancer, remission to give life a good outlook. She is admitted to the general floor with altered mental status. She was out of it. Major side effect of opiates, altered mental status. Okay. No big deal, get the OPI. Oh, I feel you, man. Sorry you had to learn that lesson in such a hard way. Took me a good year to realize my seniors weren't infallible medical gods. It's just dumb luck that those stupid orders I followed as an intern didn't lead to disasters like yours unfortunately did. But as an aside, the gastroenterologist screwed up. I'm in the military, and as I've gotten closer to 40, it seems I've begun to develop high blood pressure. On base, doctor insisted I needed medication to control it, so he wrote a prescription. To be honest, I hadn't seen this doc before and seemed a bit off. Not sure how to describe it, but he just seemed a bit less than completely there. Anyways, I walk down to the pharmacy area and wait my turn. I'm called forward and the pharmacy tech asks for my ID, looks up the order, and asks. I was at a holiday party of relatives and friends. My older uncle is a radiologist. He said a story I've heard before that he wrote left instead of right on one of his X-ray interpretations, and because of that error the patient subsequently died wrong lung with the tumor or something like that, but I really didn't get the details. Anyway, a doctor friend of his at the party said, it happens to us all consolingly. So people, it happens to them all, be really vigilant. When my wife was having our son, we had to go in for an unplanned C-section. I didn't want to look at the operation, so I was on the other side of the veil. When they were tugging at her, and the whole table was moving, I got really nervous and super on edge. I thought I was going to cry just thinking about what was happening to her body. In that moment, if someone had said oh shit, I would have either flipped out or passed out. I think that you possess a quality that a truly great doctor has to be truly great. You've got the ability to admit a mistake and the compassion to not just blow off the mistake. I commend you on that. I am in the process of recovering from severe necrotizing pancreatitis, got it at 16, now I'm almost 18 and have seen numerous doctors. Almost all had compassion, but only one, who is the one who saved my life, had the ability to admit a mistake he made, something that caused serious patient here. A doctor tried to put an Ilizarov fixator on me, for limb lengthening, without proper knowledge or experience. He damaged the growth cartilage, dislodged my fibula and destroyed my ankle. I had to get 20 more surgeries to fix his error. The initial procedure was something that another experienced doctor would be done in 2 minor surgeries over the course of 6 months. I was 2 years old when he botched the surgery, 18 when I finally finished the reconstructions TLDR of RAM. What happened to you after all was said and done? I just graduated from nursing school a few months ago, and stuff like this terrifies me. Both for the patient and myself. Holy F king shit. How did you tell that to the patient? Honestly, or did you just happen to diagnose the other original tooth and tell them just noticed, this one has to go too? This is a throwaway, obviously. I'm a surgical resident and my focus is on pediatrics. I have done a fair amount of surgeries so far and death is not an uncommon thing for me. But the worst was a case with a then 8-year-old kid. I was operating on his ulnar and accidentally caused damage on the nearby nerve. He lost about 20 of his sensory stimulus. He wanted to be a violinist. My friend who did internal med misdiagnosed the woman a simple case of splenitis. Turned out she had an ectopic P. If that had happened to me, my daughter, I would laugh so hard. I hope her mother wasn't too upset. Did you have some kind of solution to get your glove off of her head, or will she forever had a glove stuck to her face? Serotonin syndrome is not fun. I had a bad reaction to Paxil that my doctor prescribed. My whole body went numb and tingly and my legs gave out, and I could barely raise my arms to the toilet and keep my head up as I vomited. I seriously thought I was going to die.